Hello. You never guess what I was just dreaming about. I was dreaming that you are going to learn 3 points from this film. And you've already seen some of these points. The first one is that you will always brush up and down from gum to tooth. Do you know why? And that is because there is a groove running between your teeth, and the only way to brush that groove is in the groove. Never brush sideways. Secondly, I dreamt that you're going to count 2 times 10 strokes as you brush down from the gum to the tooth. And you would never guess the last point that I hoped and dreamt that you would do would be to floss your teeth regularly, if possible every day, at least once a week. Lovely dream for a dentist to have, that all his patients would do that. Marvelous. Now, I want to show you 2 bicycles. And these bicycles will illustrate why we get tooth decay. One of the bikes has a shiny wheel, and the other bicycle has a rusty wheel. How are these connected with tooth decay? What can they teach us? Let's go and look. I thought that nighttime would be a good time to illustrate my next point, because it's at nighttime that the mouth is very still and we're not chewing or talking and so on. And the bacteria start to work on the food particles that we leave around our teeth. They create an acid which makes holes in the teeth and inflames the gums. Of course, we don't want that. Now, on my left here we have a bicycle wheel for a bicycle which has been left in a moist condition instead of being dried and cleaned at night time. And of course it goes rusty. On my right here we have a shiny bicycle wheel which has been carefully looked after. Now, the comparison is very close, because in order to get a bicycle wheel to rust we need 3 components. We need a bicycle wheel, we need moisture, and we need oxygen. To get a tooth to decay, we need a tooth, we need bacteria, and food. A bicycle wheel will not rust without moisture and oxygen. A tooth will not decay without food particles and bacteria. To illustrate the point briefly, if we dug in the ground and found a prehistoric skeleton that had been buried for thousands of years, we would realize that the teeth are very strong still, but the rest of the bones become brittle. There are plenty of bacteria in the soil, and it's not these bacteria that are required for tooth decay alone. It is food particles that need to be present. A dead man doesn't eat, and therefore there will not be tooth decay. If we remove all the food from our teeth, we will not have decay either. Sit, sit, sit. There's a bone for you. Okay, there's a bone. Honey is now going to chew this bone, and in a short time the bone will be gnawed away, because her teeth are stronger than the bone. Our teeth are the strongest part of our skeleton. The strongest part of a machine, and our body is like a machine, we would expect to last the longest. We should expect our teeth to last the longest. Now, I'd like to take you into the surgery, because Lisa is going to show us the light that she uses to seal the fissures or creases on the teeth. This is called fissure sealing teeth against decay. Come with me now. This is Lisa, who is one of our hygienists, treating Lisa, who is a patient. In the surgery we believe that it is important to have health maintenance rather than disease treatment. In Lisa's mouth we have tucked a small piece of cotton wool. This is going to keep the tooth dry, and then we bring a little blue light into the mouth which shines onto the tooth. Just to show you the light outside of the mouth, it's a very gentle light, and it's an ordinary projector bulb beam, very high intensity, not ultraviolet, and it shines onto the tooth and sets a resin in the fissures or creases of the teeth. You can see here a tooth which has been sealed against decay. The shiny center of the tooth is the sealant placed to reflect or deflect the food particles as the patient would be biting down onto that tooth. Behind you can see a diagram to illustrate how the sealant lies in the central crevice of the tooth. This is a highly effective measure to prevent dental decay on especially children's teeth. We have been encouraging you during this film to believe that your teeth will last a long time, and if taken care of, they will do. I'd like to use a model now to help you to understand why we want you to brush up and down and not to scrub sideways. Placing the brush on the teeth. If you can see the grooves here between the teeth, you will also see that the soft toothbrush bristles will easily float between the teeth and cleanse the deep areas between the teeth. Most of the food particles will be trapped between the teeth. So we must realize that there's only one way to brush a groove, and that is down the groove. Any sideways brushing will not only not clean the groove, it will skip across the groove, but it will also mean that we wear away the neck of the tooth, because the enamel grain runs up and down, and once that enamel has been worn away at the neck of the tooth, then the sensitive, soft dentine will show through, and you will find that you get sensitivity to hot and cold, especially liquids in the mouth. Now, I had a patient once in Africa who brushed right through the nerves of 20 teeth by sideways brushing. His teeth were beautifully clean but ruined. Just to now illustrate the point as to why we want you to count as you brush. If I asked you, would one stroke be enough as you brush on each bit? One, all the way around, you'd say no. Would 2 strokes be enough? You'd say definitely not. 5 strokes, you say no. 10 strokes and you begin to believe that something is happening. But we believe that you must actually know that you've brushed, and so 20 strokes targets well, and you brush thoroughly. It is the only way to know that you brushed evenly around your mouth. Otherwise, if you don't count and just hope that you have spent the same amount of time, you will find the difficult areas you are brushing more slowly, and therefore they have less number of strokes. Because they have less number of strokes, they won't be brushed as well. So please count equal number of strokes on every bit. The last point that really we would like you to understand here is that rubbing the gums will prevent gum bleeding, because soft gums bleed easily. The palms of your hands, elbows, soles of the feet and kneecaps are areas of pressure where we rub on the skin. Now you will find that tough skin occurs where there is rubbing, so if we want to make our gums healthy and strong, we must rub them also. Remember, use a soft brush because you don't want to damage your teeth, and the bristles of a soft brush will flow between the teeth much more easily and polish the surface. We have now come to the end of this film. I do hope I wasn't dreaming that as young people you would remember the 3 points. 1, brush up and down, count 20 strokes on every patch of your mouth, and use floss regularly. Those 3 points. Now, we as yet haven't mentioned anything about diet. Please ask our hygienists more about this, but I would just suggest that please avoid foods that will stick around your teeth, like fruit gums, wine gums, chews and toffees. Just keep well away from those things. And you should find that with good brushing, your teeth will last you and enjoy a good mouth for life.